members, my name is Jena. I'm one of the primary care providers here at the TSIG Wellness Center. And this week I wanted to sit down and talk to you about a common and frustrating topic. I wanted to discuss a little bit about two types of urinary incontinence. And I would say I think they're some of the most common types of urinary incontinence affecting women. These are typically more seen in our female population, but they can affect males as well. This month for Women's Health Month, I wanted to bring it up because it's one of the things that I think a lot of people are dealing with but don't necessarily bring up to their provider because they might not know that there are things that we can do to help you in that department. One of the types of incontinence I want to talk to you about this week is stress incontinence. This is typically seen when there's extra pressure in the abdominal cavity, like during a sneeze, cough, laugh, and there's a little bit of urine leakage with that extra pressure on the bladder. And then the other type I want to talk to you about is urge incontinence, where you have a sudden urge to go to the to urinate and you can't quite make it to the bathroom. So those I would say are typically some of the ones we see in clinic the most often, especially in our female population. And I wanted to talk to you about some things you can do at home to maybe work on bladder training, as well as encourage you to come in and talk to a provider to see if there's other things we can do. So the more conservative methods would be to start with bladder training. So those can be as simple as having your liquids or your water intake around your meals, focusing on like a glass of water before your meal and after your meal, and not drinking any water too close to bedtime. I know I'm always big on water intake, so we encourage you to get about 64 to 72 ounces of water a day. And some of that, sometimes people who struggle with incontinence, if they're sipping water continuously throughout the day, that can trigger the incontinence. Whereas if you are grouping your water intake around meals, you will be more successful with bladder training. So that's an option. Again, the most important rule too is not having water too close to bedtime. So they say to stop drinking water about 2 hours before bedtime and fully emptying your bladder before bedtime. Other things are avoiding like alcohol and caffeine. These can both be irritants to the bladder and cause increased symptoms of incontinence. Another thing I talked about bladder training is not only grouping your water and all liquid intake around meals, but also timing the periods between when you use the restroom. This has to do with if every time we get the urge to urinate, we're running to the bathroom, and sometimes our bladder can be a little sensitive where it will send off that trigger to go urinate more often than needed. So with bladder training, they say to write down the times that you're using the restroom and try to space that out within 30 minutes to an hour, training your bladder to hold on to the urine for longer. Another thing that's common that we talk about are pelvic floor strengthening exercises like Kegels. So there's lots of YouTubes on yoga moves for pelvic floor strengthening, and also a good option if you talk to a provider, we can get you referred out to a pelvic floor specialist. So that is helpful in both stress and urge incontinence, strengthening those muscles to help control bladder and urine leakage. So luckily we have some great resources here in the Yuba Sutter region, but just talk to a provider and we can get you linked up with a pelvic floor specialist near you. Then, if those conservative methods don't work for you, there are other medications, other stimulation and feedback therapies that we can talk to you getting a referral to like an OB-GYN urologist specialist. So again, I think this is a more common problem than we might be aware of, and I just wanted to offer this little information session this week and encourage you, if you are struggling with some urinary incontinence, to reach out to a provider, and we can brainstorm options and get these symptoms, more well controlled for you, because I know they can impact quality of life quite a bit. So again, thank you for tuning in this week. Feel free to call the office and schedule an appointment to talk to one of the providers about this issue or anything else you're experiencing. And thank you for tuning in.